أهلا وسهلا. Assalamu alaikum wa rahmatullahi wa barakatuhu. Welcome to this special Enriching Talks episode with me, with Hafsa, on a special guest with me here, Aisha. I'm here. She's in here in Kuwait, so I thought, why? It's a lot. It's been a long day.
It's been a long day.
It's been a long day, but
Allah is merciful.
Yeah. So I told Aisha I'm going to grab you at the end of our training so that we can do this little talk before she has to leave, inshallah. So Jazakallah khair, Aisha, for being here. So let's just start with renewing our intentions and starting with the dua. Allahumma anfa'na bima 'allamtana wa 'allimna ma yanfa'una wa zidna ilma. I'm Hafsa Qureshi, your host for today, and my special guest speaker is Aisha. I think most of you know me. If not, you can see all who I am all on the screen. I don't want to spend too much time on my introduction. However, I just do want to remind you all of our mission and vision whenever I'm doing these talks, that this is not a normal talk show. The intention behind this is to help inspire moms, to support them, to educate them, give them inspirational stories, be there and give the support that all mamas need throughout their pregnancy, birth, beyond birth, breastfeeding, all of that and much more, inshallah. So this is the mission and vision. This is episode number 5, but which is a special episode at the same time, alhamdulillah. All right, so without further ado, I am going to introduce our guest speaker, Aisha Al Hajjar, who is the founder of AMANI Birth. And I think more than anything else, I recognize myself to be a very lucky member of the AMANI Birth family. I'm also I work for AMANI Birth as well. I'm a certified AMANI Birth Doula, childbirth educator, now an advanced one today, today,
alhamdulillah. Advanced training, mashallah.
And blessed to be part of this family since the last, I think it's been 8 years now, alhamdulillah. Right, so, and it has been a life-changing journey. Today's training was the next step, another life-changing journey, alhamdulillah. She is a certified professional midwife. Those of you, I'm sure, like many of you might know her, and those that don't know, you can see all about her on the screen. And she's also the author of the AMANI Birth book, which I feel this book should be in every Muslim household. As soon as you get married, I would gift this book literally to every girl that is getting married and planning a family, inshallah. She's also a mother of 8, Allahumma barik, and she's got lots of inspirational stories. And alhamdulillah, I'm blessed to be here. So Aisha was in Kuwait. She came here on Tuesday, and then we had the AMANI Birth training on Wednesday, Thursday, Friday. And then today we had the advanced training. So I did that training with her, and then I grabbed her for 1 hour. So we just have 1 hour, but we've got a whole list of questions. I don't know if we'd be able to take the live questions, but let's see if we get a chance at the end. I already have a list of questions that lots of blessed mamas have sent. So inshallah, that itself hopefully would answer the many questions that a lot of you have. So Aisha, please introduce yourself.
Well, you just did. So salam alaikum. Thank you so much, Hafsa, for having me. It's a real pleasure to be here with you in Kuwait. And of course, I'm here because of the work that you did to bring me here. So thank you for that. I have been doing birth work since about 2010 and training others to do birth work since about 2012 all around the world. Kuwait is one of the many places that I enjoy coming to and training women in the community. We can never have enough childbirth educators and doulas to support the moms out there. The upcoming generation of moms, those of you who are pregnant, those of you who are the upcoming generation of mothers, I just want to say what a blessing that you found Hafsa, what a blessing that you found, this venue. I really suggest that you get yourself prepared for your birth. Don't go into the labor room not knowing what to expect. Knowing your options. If you don't know your options, then you have none.
Yes,
so knowing your options and really getting yourself educated. This is my mission and vision in life, is to bring education to all of you. And I see our dear friend Fariha in Pakistan has just commented in the chat. I love you, Fariha, and I'm going to come and see you. So we'll be doing this in Pakistan here. Well. Be with you in April in Pakistan, inshallah. Coming to 3 different cities in Pakistan. So I'm pretty excited to see you soon, inshallah.
All right, so I'm just going to jump right into the questions, which I hope would answer a lot of the questions mamas might have. All right, so starting first of all, I think one of the biggest fears moms have during labor and birth when they're planning for a natural birth is the fear of vaginal tears during episiotomies.
Okay. I love to talk about vaginal tears and episiotomy. So that's the most common one. Let me start out by saying that episiotomies are an outdated practice. There is a time and a place for every medical intervention, but to do an episiotomy simply because we own a pair of scissors, meaning as a matter of routine, is a very outdated practice. It started a long time ago, along with forceps. We can get into like the whys of why we started to do episiotomies, but I'm just going to quickly say that episiotomies were a marketing ploy to sell for forceps. That's why we started having routine episiotomies. And years later, the medical community realized that maybe we shouldn't be doing so many forceps, so they stopped doing forceps as a matter of routine, but they forgot to stop doing the episiotomy that went with it. Now, in today's world, in the Western world in particular, we have so much evidence that shows that episiotomy causes a lot of harm, typically more harm than good. And when I talk to doctors who like to do episiotomies or moms who are afraid, well, what if I tear? I'm going to throw this out there. You might tear. 50% of first-time moms might tear. But I want to point out, if 50% of first-time moms are going to tear, how many moms are not going to tear? Tell me in the chat. If 50% of first-time moms are going to tear, what percentage of first-time moms are not going to tear?
Yeah.
50, right, Saman? Good to see you, Saman. Can't wait to see you in Pakistan as well. Ramesa, I see you too. Mashallah, can't wait to meet you as well. Yeah, so 50%, right? So if you've got a medical community that is still favoring episiotomies, you are screwing the 50% of the population that would have no damage if you left your scissors in the tray. Now, of the 50% that are going to tear, statistically speaking, most of them will be first-degree tears. So let me talk to you about the degrees of damage that can happen to the pelvic floor during birth. We have 4 degrees of damage. The first degree of damage is basically not that big a deal. It's a skin tear. It doesn't go into the muscle layer. Think of it like a paper cut. A lot of times we don't even need to suture these. We don't need to give you stitches. Only if it's gaping open, we need to pull the tissues together so that you'll heal properly. Or if you're bleeding heavily from that tear, do we even need to suture it? A lot of times they don't even need to be sutured or stitched, right? So if your first degree tear, most tears will be first degree statistically speaking. Then we have second degree tears. Second degree tears go into the muscle layer, okay? And I want you to understand that the pelvic floor muscles are right below the skin of the vaginal area. So if you have a doctor who favors cutting, he's going to put his scissors in your vagina and he's going to cut the vagina. He's absolutely going to cut into the muscle layer, meaning that you're going to have at minimum a second degree injury with a pair of scissors. So when you think about it, 50-50 chance I will have no damage. That's a blessing if I have no damage. Of the 50% that tear, most will be first degree, which is less damaging than the scissors. Those that end up with a second degree natural tear, well, that's no worse than the scissors. So maybe that's a gamble worth taking. Now, there are also third and fourth degree tears. Third degree goes into the rectal layer and fourth degree severs the anal sphincter. Those, of course, are more serious tears, and if not sutured properly, can actually be devastating to your quality of life. And you can certainly tear naturally to third and fourth degree, but the statistics show that the majority of third and fourth degree injuries are actually an extension of the episiotomy. Because when I cut that little bit of episiotomy, I weaken the tissues and the baby's head comes, and then the episiotomy spreads, and we get more third and fourth degree tears from extensions of episiotomies than we do from natural tears. Mm-hmm. Beyond that, a doctor will say to me, but Aisha, if I cut her, it'll be nice and straight. If she tears, it'll be jagged. That's right, doctor. That's because she will tear in the liquid spaces between the cells. The individual cells themselves don't get torn. So that means that when I cut you, I can't see those individual cells. I'm going to damage the cells. When I suture you, yes, it's a nice straight suture, which is easier for me as a midwife or a doctor, but are we trying to do what's easier for me as the medical provider or for you as the mom? Yes, I can suture something nice and straight, but I can't line up the cells. I can't even see them, and I've damaged them. So you're going to end up having a longer healing period when you have a cut, and you're going to have more scar tissue built up. When you tear, yes, it's crooked, and yes, I have to follow the little traces of wherever it's cut, but the thing is, it's better for you because you didn't tear in the individual cells. You'll heal faster, and you'll have less pain with the natural tear than you do with the episiotomy. Now, that's just a few things. I could go on probably for this whole hour about episiotomy. There's more that I could say, but I just want to say that typically speaking, episiotomy is not necessary. I am not saying it's never necessary. The World Health Organization says that we should have about a 10% episiotomy rate, which means 90% of you probably don't need the episiotomy at the end of the day. If there's an emergency, the baby's head is here and he's not coming and he's going to die if I don't get him out, then yes, we sacrifice the perineum, the mama's bottom, for the sake of the baby. But for the most part, most births going to happen without episiotomy.
And what can we do? Like, well, how can we avoid it?
Well, first of all, for you to avoid it, the first thing is finding a doctor who's not cut happy. That's the first thing. Finding a doctor who's willing to not cut, right?
Right.
Second thing is to, insist on having an upright birth position. It's very difficult to cut you when you're squatting or you're on your hands and knees, right? So that's another thing. But also I would say pay attention to your own nutrition so that your tissues are soft and supple. To your own exercising, exercise your pelvic floor, just like you want to exercise and make your, exercise and make your biceps strong. You also want to exercise and make your vagina strong as well, so that you have a nice, firm pelvic floor that is better for your sex life, frankly, and it's also better for the baby's birth. So, at the end of the day, there are things that and these are the kind of things, Hafsa, that you cover in class.
Yeah, obviously.
I can't, if you want me to talk on more topics than episiotomy, we're already 15 minutes up. I don't want to get into everything, but I want you to exercise and eat well, take care of this part of your body, just
Educate
like you
yourself.
would. Educate yourself. Take care of this part of your body. Shop around for the doctor that's going to be most supportive, guys. Don't just go to the one closest to your house. Shop around looking for a care provider that's going to be supportive of the birth plan and birth ideals that you have. So that's a big part of it is care provider choice. So you have to find the right care provider, and then of course having your own body prepared. And I would also say stay off of the epidural and the debilitating drugs, because if you can feel when you push, you're far less likely to tear yourself than if you're pushing because someone's screaming at you to push because you can't feel anything.
Right.
So I'm very much about undrugged labors. I don't think that birth is unbearable. I think that birth is you can definitely cope with your labor. It's not as bad as a lot of people think it is. We fight our own labor and we make it worse than it has to be. So again, it goes back to getting educated, being prepared, going into that labor and birth, really ready for what's to come.
Okay. Next is vaginal exams, which would be linked with another question that's up here, which is membrane sweeps.
Okay. So talking about vaginal exams, a couple things that I want to say. Vaginal exams are not the be all end all. Okay. They are a guesstimation. When I do a vaginal exam, I might say you're 4 centimeters. Somebody else could do the same vaginal exam and say you're 3 or maybe 4 or 5. Okay. At the end of the day, it's subjective. There's no tape measure on my fingers, right? I would probably say that everybody that does vaginal exams would agree what 1 centimeter feels like, maybe 2 centimeters and 10, because 10 is really not 10 centimeters. It just means there's no head. I only feel there's no cervix. I just feel the baby's head. But everything between 3 and 9 is really guesswork. And, I can remember when I was a midwifery student, being in a Saudi hospital, I was doing some volunteer work so I could get some experience. And so we approached a young woman who was there for whatever reason she was there for. And so I have to do the vaginal exam. I do the vaginal exam and I say she's however many centimeters that I think she is. And the doctor, of course, has to do one right after me. I'm a student. You can't trust me. Does the vaginal exam and came up with a different number. And I remember being very frustrated. And we went back to his office and I said, how many vaginal exams did you have to do before you felt like you knew what you were doing in there?
Exactly.
And he says, maybe 50. I was like, okay, fair enough. I haven't done 50 yet. He says, but I got to be honest with you. I'm only 70% accurate anyways. I was crushed. As a woman, I was absolutely crushed. SubhanAllah, you're telling me that you were making decisions about things like breaking my waters, giving me drugs to speed my labor, calling it off and doing a C-section based on your 70% margin of error? That's huge. I was really, really upset when I realized that. And then also later on, as I became more experienced as a midwife, at the end of the day, I recognized that, vaginal exams are so subjective and mothers can actually reverse dilate if they're uncomfortable, fearful, upset. How many of you like having a vaginal exam? I would say the answer to that is 0, right? So if you feel uncomfortable and you don't like having a vaginal exam, that in and of itself can cause you to have a false reverse dilation where I'm doing a vaginal exam and finding you maybe 4 centimeters. I keep finding you 4 centimeters. You might actually be dilating, but every time I come in to do your vaginal exam, you get upset and scared. And so your cervix closes down as a protective mechanism. And it's not really, to be honest with you, that indicative of what's going to happen in your labor. I can tell a lot more about what's happening in labor, about your behavior, and how you're going through your
like
labor.
the demeanor of the mother and how she's going,
exactly, than any vaginal exam. Subhanallah.
Subhanallah. All right, excellent. Thank you so much about that. And what about the whole misconception about big baby and small pelvis and all of that?
Well, let's say a couple things to say. Number one, and who's saying we have a big baby, and where are they getting their information from? Probably an ultrasound, right? Mm-hmm. Ultrasound can be off by a whole kilo. Do you know how many women have been told they're having a 4-kilo baby and it turns out to be a 3-kilo baby?
Right.
Subhanallah. Or it's going to be 3.5 and it's not even 3. Subhanallah. So your weight by ultrasound is nothing more than a guess. Your due date by ultrasound is nothing more than a guess, frankly. Mm-hmm. If mom and baby are doing well, I don't pay a whole lot of attention to that. Now, if mom has diabetes, for example, uncontrolled, she has her sugars all over the place, then yes, we're more likely to have a macrosomic or very, very large baby. So absolutely, when I talk about this stuff, I'm talking about healthy low-risk women who are, keeping themselves healthy and eating well and exercising, etc. With all that being said, I've seen some of the smallest women give birth to some of the biggest babies, right? And also I want to say, what position are you in when you're giving birth? How many of you are laying on your back with your legs up in the air, which is what I call the dead cockroach position? This is the worst position. Wallahi, this is the worst position to give birth in. It actually literally closes off your pelvis when you're on your back with your feet in the air. Why in the world would we want to ever be in that position? Subhanallah. You need to be upright and mobile. Let your pelvis open up. You have 30% more space in your pelvis when you're squatting than when you're laying on your back with your feet up in the air. Subhanallah. So talk about a big baby. Is it really a big baby, even a small pelvis? Or is it that someone has put you in a position that makes it almost, twice as difficult for you to get the baby out? Right. Subhanallah.
True. And you're just like, by 30%, you're closing the whole pelvis space.
Yeah.
Yep. Right. Okay. The next question was about the liquor, the amniotic fluid. So the midwifery, midwifery point of view of why more women are having PROMs or low amniotic fluid.
Okay, well,
what can be done?
When we talk about low amniotic fluid, so first of all, we're talking about, again, a measure by ultrasound. First of all, how many ultrasounds are you people having? If you lived in the West, you would get at most 2 ultrasounds. You get one early ultrasound to date your pregnancy. Well, we're trying to figure out what's your due date. The earlier the ultrasound, the more accurate the dating of the pregnancy. We're also trying to find out if the baby is viable and is it in the uterine area, or is it an ectopic pregnancy, meaning out in the abdominal cavity, which is not viable pregnancy. Mm-hmm. And then we're also looking for, is it multiples, singleton or multiples, right? If you have twins or triplets or something going on. So you get that early ultrasound. Then you get one around 20 weeks, which we call the anomaly scan, or for your sake, maybe we'll call it an anatomy scan so you don't freak out. We're basically looking for any anomalies or looking at the baby's anatomy to make sure that there's nothing going on with this baby that would change course of care. You got a baby with 2 heads, he's not being born vaginally. You have a baby whose heart is outside of his chest, he needs to be born cesarean, he needs to have a cardiac team on hand at birth, right? So we're looking for those kinds of major anomalies, right? As long as your first and second ultrasound, the early one and then the one around 20 weeks are, everything seems to be well, there's really no reason to do any more ultrasounds. I only see these serial ultrasounds happening in Muslim countries, and it just actually freaks me out. I see it in the Middle East. I see it in the Southeast Asia. Sometimes I wonder, are we using Muslim moms as some kind of an undocumented experiment? We know ultrasound changes cellular tissue. We know that ultrasound causes bubbles in cellular tissue. We don't know what the long-term effects are for our babies.
Honestly, I feel like they don't know what to do with you. Yeah, unless they've done an ultrasound.
Well, not to mention they've set up a culture where women expect an ultrasound in every visit, and so if they don't give it, then they think it's a bad doctor. He didn't do anything. He didn't do an ultrasound. We need to, as moms, stop expecting and accepting ultrasounds at every visit. You don't need them. We don't know, to be honest with you, what harm that might be causing long-term to the babies. Yeah, just like the antibiotics. You're right, Miriam. Right. Just like the antibiotics. We need to stop accepting stuff just for the sake of we can do it doesn't mean that we should do it. Mm-hmm. But anyways, getting back to the low AFI. One thing that I will say is there's AFI and then there's what's called deepest vertical pocket, DVP. I'm not a real fan of this science, if you want to call it science to start with. But at the end of the day, if we're going to be using those measures, we need to be looking at the deepest vertical pocket. That is more indicative of how baby's doing than looking at the AFI number. The AFI number is so variable. and the baby moves around and the water moves around. So the deepest vertical pocket is actually a better measure of the baby's wellness. But at the end of the day, my thoughts really are, is the mom and baby doing well? I'm more concerned about that. Is baby moving well? Is mom tolerating the pregnancy? Realizing that the amniotic fluid is going to drop as the pregnancy gets further along. That's normal. We expect that. There's less room for the baby. And so therefore, you're going to end up having less and less amniotic fluid when you get closer to term. As long as the baby is doing well, heart rate is well, baby's faring well in the womb, I'm not too concerned. You're not going to have a dry birth. Also, make sure that you're well hydrated, obviously, because the amniotic fluid continues to regenerate. So, did you go in for that ultrasound and get told you had a low amniotic fluid and you haven't had water for 2 days? Are you dehydrated? Is it a hot day? You've been sweating. Like, you need to make sure that you're if you're gonna subject yourself to these exams, and I question why are you subjecting yourself to so many exams, but if you're gonna subject yourself to these exams, at least go in well hydrated.
Right.
Again, coming back to nutrition, hydration is part of the whole nutrition concept of taking care of yourself.
Right. Thank you so much. Now, while we talk about that, a lot of mamas want to consider water birth now, those that have that option.
Yeah.
So what would be the pros and cons, since you would have probably assisted water birth?
Of course. In my home birth practice in Delaware, we do water births. I am a water birth. I'm also an instructor at midwifery college, and one of my classes that I teach is water birth. Water birth is amazing. It gives moms a lot of relief of pressure and the buoyancy. It feels great. The nice thing also about water birth is its privacy. Like, nobody's staring between your legs. Right. There's no risk of anybody cutting you when your bum is under the water, So moms tend to have a more positive birth experience with water birth. Babies, when they're being born into warm water, they don't realize they're born for a split second until you lift them up out of the water. It's actually a much smoother and gentler transition typically for the baby from womb into world. The research shows that when moms have water, they tend to have less pain medication, which means less complications for both mom and baby. It also means that they have higher satisfaction with their birth. So all of the research shows that there's really no risk to water birth, so long as it's being done with someone who is a qualified care provider, making sure that the environment is, the tub should be cleaned properly. We should make sure that the water is clean. Obviously, if that we don't have you in the water so long that we end up with, the water being contaminated. Water shouldn't be coming from a source that could potentially have any kind of bacteria in it. So what's your water source? Also considering when we think about water birth, it's super, super important that someone is checking your baby at least every half an hour in first stage. This is for any birth, but water birth is included. But in water birth in particular, that we're checking your baby every 30 minutes in first stage labor, every 15 minutes in transition, every 1 to 5 minutes in pushing stage. Because the reality is that if your baby becomes in stress in the womb, he will try to breathe before he's born. And that means when his head hits the water, he may be trying to breathe and he may drown, right? That's only if the baby's compromised. So I would not ever recommend somebody have a water birth without a qualified provider who is keeping tabs on the baby to make sure that the baby is doing well. As your water birth midwife, if I have any sense that your baby is in any kind of distress in the water, we're getting out. I'm sorry. I don't care how much you wanted this water birth. You're getting out. The baby has to be picture perfect for me to allow you to give birth in the water and for that to be a safe experience. The other thing that I think a lot of people don't realize is you have to be careful about mother's hydration in the water. Because you're in the water, sometimes you forget that you're sweating.
Oh, subhanAllah.
Right, because the water, relieves you from the sweat and you're wet anyways. One of the problems with sweating is not only dehydration. So you think, okay, drink water. It's also you're losing sodium. And if I'm in the water and it's a warm bath and I'm sweating and I'm drinking lots of water, I can end up having low sodium. Low blood sodium is called hyponatremia. You can actually die from hyponatremia. So super, super important that we have, and this isn't any labor, but in particular water birth, mom should be drinking lots of water, but not just water. We should be balancing that with electrolyte drinks. So, maybe some water this time, maybe some coconut water the next time.
Yeah, I was going to ask you that.
Yeah.
So what would you suggest? What are good things to eat and drink during labor?
Well, you can't get any better than what Allah subhanahu wa ta'ala prescribed for Mary. Yeah. Dates and water are perfect in labor. But like I said, if it's a long labor, your water birth or whatever, I would just do dates, water, and maybe, every other sip I would do, an electrolyte drink. Whether that be a homemade, either a homemade electrolyte drink, coconut water, the store-bought Gatorades. I mean, that's what we have in America. I don't know what you have overseas.
We have like the ORS.
Yeah, I don't know that one.
Yeah.
But an electrolyte drink, just to make sure that your sodium stays, just so that your sodium stays balanced, right? Alhamdulillah.
All right, next one. I think breech. So the presentations of the baby.
Okay.
So the question was, we know breech baby isn't a complication. Now, this is a mom who has educated herself, but what to do if professionals around are not trained or confident or supportive?
All right. So let me just start out by saying, okay, breech is not a complication. It's a variation of normal. However, some breeches are a complication. So we have to back up for a minute and start by saying, what position of breech are we talking about? Because we have a breech where the baby's butt is coming first, which is much like the baby's head. And so that will cause nice, steady, even dilation of the cervix. But then we also have a footling or a kneeling breech, right? If you've got a footling breech, especially if he's got one knee and one foot down, his foot can slip through the vagina at just a couple of centimeters, right? And then the foot comes in contact with air, and then the baby's trying to breathe well before he can be born. This is a complication, okay? And the other thing that doctors get scared of is potentially the baby's head getting entrapped in the pelvis. Number one, and this is more for doctors than for you guys, is to learn how to deliver a breech. And a lot of it is really about being hands off and letting the breech do its own thing. But if you don't have doctors who are confident with breech, the best thing I can tell you is shop around and look for the older doctors, because they did breeches back in the day before they could do anything else, right?
They didn't have a C-section option.
Exactly. Or they didn't do C-sections as a matter of like routine like they do today. They only did C-sections in really serious cases. And I can remember being in Egypt with one of the senior doctors, and I remember him looking at me and saying, it's such a shame that the art of the breech has been lost to the night.
Yeah, I remember that statement's there in our AMANI version.
Absolutely. The art of the breech being lost to the night. I'm not saying that every breech baby should be born vaginally. I personally feel every breech baby should be a water birth baby. So the reason that I say that is because realize that part of the risk is that the baby's body hits the air, baby tries to breathe before his head is born, right? That's the issue. Well, he's born into water. He doesn't know he's born.
Oh, wow.
Right? Because it's a warm environment. So personally, I think all breech babies should be water babies. That's my personal opinion. May not be an option where you live. You might not have care providers that are willing to support breech birth. At the end of the day, like if you don't have a care provider willing to support, I don't know really what to tell you other than to shop around for another care provider. And I would also say sometimes we're limited by what I call elephant thinking. We think, well, I can't do that here, or I can't have that because of whatever. You could travel. At the end of the day, like there's never ever, money might be a reason, but at the end of the day, I look at people and say, how important is your birth to you?
Right.
If your child had had some kind of an illness and the only treatment was in Russia, would you not find a way to get there?
Of course.
Would you not do what you had to do? Like you can travel somewhere else and find support if there's no support, or you don't think there's any support, or whatever, where you live. You don't have to, just because I live in Kuwait, give birth in Kuwait.
Right.
You don't have to, just because I live in Saudi, give birth in Saudi, or Pakistan, or India, or wherever.
Yeah.
And there are supportive doctors around the world. So it's a matter of finding and then seeking,
Yeah. So very saying as well, the government hospitals in Pakistan would be more experienced because of the fact that they don't want to use up too many resources.
Yeah, good point, Fariha. MashaAllah.
Yeah, subhanAllah. Which reminds me, she's now our affiliate. She was a blessed mama. She's now an affiliate. Be back after 4 C-sections. She traveled. She knew she couldn't have the birth here, so she traveled and had a home birth.
MashaAllah.
So yeah, that's I love the travel part, and I really think you should badly want the birth you want and not leave any stone unturned.
I would also say when we talk about breech, like what are you doing to try to rectify that as well? Like, are you, like Spinning Babies is my favorite website for positioning a baby in the womb. Are you doing your inversions? Are you having someone work with the rebozo to try to help turn your baby? We just did this in the advanced class today.
Yes, today we did it.
to help turn the breech baby, right? Because obviously a head down baby is going to be most likely better for you and better for the baby. Now, there are some babies that need to be breeched for whatever reason. Maybe they have a short cord. Maybe there's some reason why the baby needs to be in a breech position. You can also try to get an ECV done, external cephalic version, where you go under ultrasound monitoring, because when we turn a baby, we could cause a complication. So you want to make sure that you're somewhere where we're monitoring the baby while we're trying to turn the baby, and at the same time recognizing that if something goes wrong, you might end up going straight from that ECV into a C-section. But at the end of the day, like there are doctors out there that will turn babies prior to the birth. There are doctors out there that will deliver breech babies. And then there's some breech babies that really need to be born by C-section. So it's a matter of like understanding all of the different options available to you.
Right. Fair enough. Now there are a few post-birth situations. Let's talk about the pre-birth.
Okay.
So SPD, for example, pubic symphysis.
Yeah. So symphysis pubis dysfunction. This is where the front of the pubic bone has separated. You get a couple of millimeters of spread in the front of your pubic bone as a normal course during your pregnancy to allow space for the baby to pass. And the front of your pubic bone is made out of cartilage, which is the soft bone like what's in your nose and in your ear. And that spreads under the influence of a hormone called relaxin that allows that pelvic to kind of spread. When you get too much spread is when you get SPD. And so you have an excess of this hormone called relaxin. And so what that also means is that if you have this problem in one pregnancy, you're likely to have it in all your pregnancies, unfortunately, because it's your hormonal makeup, right? But when you walk, you'll hear like a clicking sound. Sometimes it's very painful. For some women, they end up on crutches or actually in a wheelchair. The best we can say to you is, is to bind the hips, right? They have like the strap with the Velcro belt, right? Yeah. To help bind the hips. But sometimes it's so severe that it is debilitating. The good thing is it's usually fine once the baby's born, but the bad thing is it's probably going to repeat in every pregnancy.
How would that impact the birth?
No, it shouldn't really impact the birth much. What it does impact is your ability to exercise, though. You might not be able to do squats, depending on how bad it is. You might not be able to do squats. You offer help. Oh, good. Here, you offer help with SPD. I'm glad to hear that. Thank you. Alhamdulillah. So everybody write down Hira's number, or Hira's name, whoever was asking. But anyways, at the end of the day, like we don't want to be forcing like a deep squat if it's causing pain. You might have to modify your exercise routine, etc.
Okay. So postpartum. Now let's start with the emotional aspect. How to self-diagnose PPD.
All right. Well, there's 3 levels of postpartum depression. We have baby blues, which is like, it comes on a week or so after birth. You're crying. You don't really know why you're crying. Like, I'm happy. Like, I wanted this pregnancy. Everything's great. Like, the birth was great. My husband's great. I love my baby. I don't know why I'm crying. The baby blues are not that big of a deal. They do happen in about 86% of cases. 86% of moms suffer some level of baby blues. I personally feel that baby blues is really a reflection of the fact that every woman who gives birth suffers a loss. I am no longer Aisha, I'm Khalid, right? Yeah. I no longer have my bodily autonomy. I have a child sucking on my breast for the next, 2 years. I used to be able to wear, a size 6 jeans, and now it's like I still feel like I'm 6 months pregnant. I look at my husband who, jumps up when his cousin comes in town and says he wants to have a cup of coffee and says, I'll be back. I'm going to go out for half an hour with my cousin and have coffee. And you're sitting here thinking, if my girlfriend showed up and said, come meet me at the coffee shop, like I can't just jump up and go. Right. His life outside the home hasn't changed. That's you now. So yeah, I know for you. But my life has changed. Every moment of my life has changed. And I'm forever in a postpartum state. Right. And so I think it's like all of these little losses that are not necessarily bad, but there's a new you. You're not who you used to be. Where your husband is still who he used to be outside the house, right? But you're not who you used to be. And maybe you used to work, and that's you too, mashallah. Maybe, you used to work and now you're not. And so maybe you're losing the autonomy of your own income and your colleagues at work that were your friends, and you don't get to hang out with them anymore. Not that this is a bad thing. Alhamdulillah, you get to stay home with your baby if you do. But, all of these little things just kind of add up and lead to baby blues. So baby blues are not clinically significant. They usually come on about a week or 2 after birth. They're self-limiting. They last maybe a couple of weeks, and it's just that crying. I don't know why I'm crying. It's the hormones. It's all the stuff, right? And the adjustment. Then we have true postpartum depression, which is more clinically significant. Now, the good thing about postpartum depression is that usually you do know that you're depressed. Like, you don't want to eat. You don't want to feed your baby. You don't want to shower. No matter how bad you stink. You don't want to get out of bed. You don't want to turn the lights on, right? You don't want to care for your baby. Like, you just don't enjoy all the things you used to enjoy. Like, you don't enjoy all of the things that you did before. So at the end of the day, like, postpartum depression is more clinically significant. It usually comes on a little bit later than baby blues, and it can last longer. And if we don't get a handle on it, it can become then lifelong depression, right? It become chronic. And so that's a problem. Now, a lot of the places where some of you might come from, there might not be good mental health care. There may not be good diagnosis and treatment for postpartum depression. And this is why it's super important to have your tribe. to have your women's circle. That I know Fariha, for example, in Pakistan, has a wonderful women's circle that she facilitates, where you come and you can debrief and you can just share and get things off your chest. And I think that's super, super important that as women that we have our women's sister circle.
Online birth circles and stuff. Any place that women get like a non-judgmental situation.
Right, exactly. And just being validated, being heard and validated makes a difference. Now, the next level of postpartum depression is really about postpartum psychosis. And this one's scary because this is the one where mom seems to be doing well, and then she has a crashing postpartum psychotic moment where she might harm herself or her baby. It can happen to anyone, but it is more likely to happen to women who have had very traumatic births, women who have underlying mental health disorder, which a woman could have an underlying mental health disorder, but if you're in a community where that's not ever diagnosed, then we might not even know it. But anyways, the one thing that I want to say, for those of you who are childbirth educators or doulas, or who might be someone supporting a woman on her journey, sometimes they'll reach out for help right before a psychotic moment. And if a woman ever says anything that seems threatening, even jokingly or in the midst of a normal conversation, she says some kind of a threat against herself or her baby, please take it seriously. Don't let her be alone. Super, super important that we provide good support for these women, subhanAllah.
Alhamdulillah, now I think the fact that we have all these online therapists as well.
It's much better, yeah.
And we should, I think the culture, taboo part,
is going away.
And we need to work on that. I mean, I would suggest all of you ladies that are listening to us now, look around you. You never know, you might reach out to someone who's probably going through this and needed someone to reach out to. I think that whole change in the culture part that, it's mental health is not something we need to take seriously. I'm sorry. We need to change that.
Yeah, absolutely. And there's nothing weak about getting help when you need help.
Exactly.
Wallahi, there's nothing weak about that. And you have to understand too, what have we done to ourselves? I don't know about where you guys live, but like where I live, like we're separated from our extended families. I don't have the support. You might not have the support of your mother, of your sisters around you, of your aunties. There was a time where like women were birthing together, like the community came together around a birthing woman and they supported one another. And we need to rebuild and reclaim, those circles and those spaces for women, subhanAllah, in so many ways.
That's why I tell the moms, so once they've taken the Blessed Start classes with me, I do these big groups.
Nice.
And
they support one another?
Yes, subgroups of it
I love
as well.
it. Yeah.
And just to make sure that I tell them my support never ends with the classes. You need to make sure that you're always supported. I see lots of questions coming up, but I want to finish this list first.
Yeah, I know. I'm trying. I'm like half reading with one eye and then watching the list. She has a phone in her hand with a list of questions that were pre-asked.
Yes, pre-asked. So I gave priority to my blessed mamas to send me that long list.
Mashallah.
Alhamdulillah. So some of the physical things. So postpartum things like urine inconsistency and hemorrhoids.
Okay. So both of those actually are a sign of a weak pelvic floor. Mm-hmm. And so the best thing that I can tell you is to make sure that you prenatally, of course, work on keeping your pelvic floor strong. And then after the birth, work on your pelvic floor rehabilitation by working on your pelvic floor exercises. If you're in a community that provides or that has pelvic floor physiotherapy and you're suffering with things like urinary incontinence, hemorrhoids, etc., I would highly recommend that you go see a pelvic floor physiotherapist. Mm-hmm. They can work wonders with you in helping you to rebuild the muscular strength down in your pelvis. It's a muscle like anything else, right? Now, the beautiful thing, Allah created this part of the body to stretch and return to its normal shape, right?
Right.
So at the end of the day, like this part of the body is designed for this stretch and return. So at the end of the day, like you're designed for this. But if you do your pelvic floor exercises and keep that part of your body taken care of, usually we can recover from any of those kind of things. Now, if you have a third or fourth degree tear, you are certainly more likely at that point to have some long-term issues. So super, super important that you have a good restructure. Like I, as a midwife, if you had a third and fourth degree tear, like I'm taking you to my friend who's a urogyne specialist. I'm not suturing you. I'm taking you to a surgeon, right? Yeah. I'm taking you to a good surgeon because you want to make sure that that stuff is sutured properly and that you get good healing so that you have the best outcome afterward, inshallah.
SubhanAllah, Aisha, I think personally, I've had those that know me, I've had a C-section and then 2 rebats, alhamdulillah. Yeah. And I think I had and people think it's a vaginal birth causing.
Oh, no, it's the weight of the baby.
Yes. So I had my worst hemorrhoids after my C-section.
Yeah.
And just because I was more well prepared, I did everything which is taught in the AMANI birth course. So my both vaginal births or natural births were way, way better, alhamdulillah, compared to other, like that C-section experience itself. So yeah, so please work on your pelvic floor. Do the exercises you're taught. Be consistent about it. Allah has given you these 9 months to prepare. I would say even if you have 9 days, 9 weeks left, it's never too late.
Well, the good thing too is the pelvic floor responds pretty quickly to exercise.
Yes.
So that's the good
one
part
of my
too.
moms, she said she actually had like dripping urine, and subhanallah, she did those pelvic floor exercises, and within a week she saw a difference.
Mashallah, yeah.
So yeah, that's such a beautiful thing. So now what I do advise my mamas is when it comes to interventions and all the hospital births and stuff, I tell them, you want to labor at home and go all the way till the end and stuff. So one of the mom, I understand her fear there. She's like, if by any chance a mother bearing pains at home faces home birth without any assistance, what should be her instance to tackle and not to panic?
Okay, so the first thing that I want to say is don't plan an unassisted birth. So that's the first thing that I want to say. I don't ever want to encourage someone to plan an unassisted birth simply because birth can flip hard and fast. And I don't want anybody to ever be in a situation where they don't have the proper care that they need should they give birth to their baby and have a complication. But on the flip side of that, if your baby comes so fast that you just really can't get to the care to the hospital in time, first of all, the first thing I say to you is don't panic, right? Women have been giving birth at home and still give birth at home all over the world. It's not the end of the day, right? And if the baby comes fast most of the time, then things are going well, right? But I first of all want to say I would like every single adult person be trained in CPR. Okay, I am.
We did that today.
We did that today.
I loved it.
I am a CPR instructor. I really, really believe that everyone should have CPR training. And by the way, in the advanced AMANI training, we do the CPR. So anybody who's like coming to any of my trainings where we're doing advanced, like the regular training's 3 days. The advanced is an extra day. It's worth doing the extra day just for the CPR, frankly. But anyways, because if the baby is born and not breathing, you need to know what to do to take care of to get the baby breathing, right? But beyond that, then we have the issue, how is mom doing, right? Most of the time, mom will be just fine, especially if we put the baby to the breast right away and she's able to breastfeed. Guys, most births will go fine. So I don't want you to panic. Most births will go fine. But there are births that don't go so fine. And this is why we don't want you to plan an unassisted birth. But if you are in an unassisted birth, you're only going to be able to apply whatever knowledge that you have, right? Okay. There are certain things that you can do to help resuscitate a baby. There are certain things you can do to help a baby who might be shoulder dystocia where they're stuck. There are certain things that we can do to help a mom who might be bleeding too much. Transfer to the hospital, obviously, if there's any complications. But most of the time, your birth is going to go fine, inshallah. I just don't want anybody to put themselves in that situation on purpose, right? Because at the end of the day, like, you just don't know if you're going to be the mom that's going to have that one in 100,000 or 1 in 1,000, whatever it is, who's going to have a complication. So
right, I agree with that part. And honestly, there is a whole module. If you take the detailed Blessed Start classes by AMANI Birth actually has 2 videos by Aisha on emergency birth guidelines. So the answer to this question would be there, right? And neonatal resuscitation.
Yeah, we talk about neonatal resuscitation.
So don't miss out on those, all right? Yeah. So make sure you've done your part. Complete your education completely. Make sure you're well prepared. You've taken the classes. You have the support. And that also kind of helps you with the mindset and the right preparation.
All right, I just want to acknowledge a couple of things that are coming in the chat. Miriam L says, if a mama is laboring mostly at home, how can we have a check on the baby every hour or so? Well, first of all, you can't, right? Unless you yourself know how to check a baby's heart rate. I usually will tell moms, like, look, stay home as long as possible. But obviously, that's assuming that you feel well, baby's moving like normal, that you're able to handle your contractions. If at any point you feel anything doesn't feel right, obviously go in. If you feel anything in your vagina, obviously go in. If you're wanting to get baby checked, you can always, I say this in the communities that I've worked in. You can go to a clinic that doesn't do deliveries and ask them to check on your baby.
In most places, Aisha.
Yeah, I know. I just want to make assumptions, right? Yeah. But if you go to a clinic where they don't do deliveries, into like a walk-in clinic. They can check on your baby. You can double check and just reassure yourself that everything is going well. So that way, you get the peace of mind the baby is doing well, and you can continue your labor. But at the end of the day, like mother's intuition, usually like when it's time to go into the hospital. More often you're going too soon than too late. Subhanallah.
Right. Yes, exactly.
Yeah.
And I want you mamas to be well informed and strong enough to know that, okay, I'm not going in for admission. I'm not handing myself over.
Yeah.
I can walk out.
Yeah, you don't have to. You walked in, you can walk out. You're not in prison.
Right. Talk with your feet.
Yeah, exactly.
Yeah.
Yeah.
All right. So now there are a few questions to you, Aisha.
About me.
All right. Yes. So I love this one. So what's a typical day in your life? So how do you manage your work-life balance with 8 kids?
Oh my goodness. Well, first of all, in today, 2025, 5 of my children are adults, right? And the other 3 are teenagers. So I'm at a point in my life where all of my children self-hygiene and self-feed, and they feed me actually. My children have been, though, a huge part of my journey and my support. Yes, I have 8 children, and yes, at one point they weren't all adults. But by the time my one daughter was 12, like she was doing all the cooking, while I was studying midwifery and she was helping out. We always had a sense, we always had a sense of partnership in the house, and the kids all did their part. I've been very blessed, alhamdulillah, that my children haven't ever given me a hard time. My husband has been supportive. My children have been supportive. But in terms of today, a day in the life, I open my eyes and I do AMANI birth work until I close my eyes. And then I open my eyes and I do AMANI birth work until I close my eyes.
And then I worry about her. I'm like, Aisha, when do you sleep?
Yeah,
I worry about, are you taking care of yourself?
Yeah, about 4 hours a night. And then I'm like, no, I gotta get up. I got the stuff to do,
And then I feel that anxiety. I'm like, I feel her, like, because she's working on the academy, she's traveling, she's like, I'm feeling it from her. So subhanAllah, like that connection.
But like I said, I have a very, very supportive husband who does this work with me. I don't think I could do it if I didn't have his support. My children are also very supportive. I can count on them. They're very, very helpful in terms of just around the house. I've got a couple of kids that are traveling with me right now. So I don't feel so much like I've abandoned my kids at home, because I've got a couple of, I don't have all of them with me, but I have a couple of them with me. I don't know. It's just like everything it's a family business, I guess. And we all, like the whole family understands the value of the work
AMANI
that we're
family,
doing.
Aisha. So the amazing AMANI family you've built, right? We have each other's back.
Yeah, absolutely. I don't know. I think I have the best job in the world. And when you love what you do, then you're never actually working. So, alhamdulillah.
Aisha said that to me in 2017 when I did this training first, the AMANI training. She said, make it a passion and you're never working again.
Yeah, absolutely.
And I really stand by it. So whatever I do, and I'm sure other CB and doulas can reflect on that same, whatever I do is pure passion, right? It is driven just because you love it. You love it so much that you give your 110, 200%. And it never feels like work. It never feels like you're getting tired.
Exactly. I travel so many places in the world, and people are always like, oh, you're so lucky. You've been here and you've been there. I said, yeah, I've been in training rooms. What have I seen of Kuwait? I saw the inside of a hospital training room. I saw the inside of the training room that we did our class in today.
I didn't go more time here.
I didn't go anywhere. Subhanallah. I just want to address Rabia real quick. She's asking how to overcome postpartum depression if it is just progressively getting worse. Please get clinical help.
All right.
Please get clinical help because you may need meds to balance your hormones. You may need talk therapy. Who knows? But at the end of the day, like, it is important that you insist on seeing someone who is a specialist in postpartum and giving you postpartum support and diagnosing postpartum depression. Don't just let it fester, because it can, like I said, become chronic, lifelong depression, and I don't want that for anyone.
No suffering in silence.
No suffering in silence, right?
Yeah.
And is it possible to, after 2 C-sections, after 5 years of the last C-section, to have a VBAC? I'm going to say she's not even online. But I'm just going to say that most likely, yes. We have to think about what's the reason for the prior C-sections. Is that incident likely to recur? But and just looking at the situation of the mom, but typically speaking, yes, it absolutely is possible to have a VBAC after 2 C-sections.
This question has been come up. So explain
the high FA. So having high amniotic fluid, there could be many different reasons for it. Sometimes it's a sign of a Down syndrome baby, but not always. It can be a sign of kidney problems with the baby, because part of the amniotic fluid, it's really made up a lot of the baby's urine. The baby drinks the fluid, urinates, drinks the fluid, urinates. And it may be a sign that the baby is not processing the fluid the way that they should. And sometimes it's just nothing. So
it's an inaccurate measurement.
It's an inaccurate measurement, or there's a lot of fluid, but it doesn't really matter. One of the biggest deals with high amniotic fluid, though, is that when the water does break, there's so much water that we have to be really mindful of the potential for a prolapse cord, right? So that's just something to be very mindful of with high AFI. But if that's what you have, it's not like there's anything you can do to fix it or anything that you did to make that happen. So just make sure that you're in good care, good communication and care with your care provider. At the end of the day, most likely it's nothing and everything will be fine. But in some cases, it is indication of complications. So
right. I missed one question: the birthing positions.
Most of the question.
Yeah. So birthing positions. I'm assuming. Make sure that you've attended session module 7 of our Blessed Start. We talk about birthing positions. I show you birthing positions. I have my camera on. I have the pelvis. Just make sure you please educate yourself so you know birthing positions, whether you're having a home birth, whether you're having a hospital birth, whether you're on the bed, on the floor, anywhere. Yeah. Please educate. Yes, the worst position is on your back.
Yeah, absolutely. Staying on your back closes off your pelvis. There are some women that do actually prefer to give birth on their back, but not typically. That is not an instinctual position. Yeah. Most of us would not lay on our back and put our feet in the air to give birth, except that someone told us to. At the end of the day, like, your body knows what position is best. And if you tune into your body will actually put you in the position that you need to be in. But for sure, hands and knees is a great position to give birth on. Laying on your side might be good for a fatigued woman. Squatting is a great position to give birth in. It opens up the pelvis. But my main goal is that moms have freedom to choose the position that they want. Number one, that they've got a care provider that will allow them to choose the position they want without having it be a big fight. Number two, that you're off of the epidural and pethidine and other pain relieving drugs that make it impossible for you to use your own body so that you can be in a birth position of your choice, right? So those are the two top ones. Beyond that, a woman should be able to birth in whatever position that she wants, as long as she doesn't have any kind of complication that requires her to lay down and have a C-section, you know? So
and remember, you take the lead, and for that you need confidence, and for confidence you need the knowledge. So knowledge is power.
I want to reply to Manor here, asking how many kids did I have when I started pursuing my profession, because sometimes first-time moms can be under a lot of stress because of being with the children all the time. I started my work in birth work when I was pregnant with my 8th child. So I was a mom of 8 at that point. None of them were adults yet. Of course, at that point, they were all still children at home. But I'm a very big fan of getting your kids into responsibilities young. Like, a 3-year-old can do housework. A 5-year-old can clean a bathroom. Right. A 7-year-old can do laundry. At the end of the day, like, getting all of the children involved in, the house is a community, and they're members of that community, and getting them involved in that's how
honestly, I think that most of the expat community, like, because we don't have help.
Yeah, exactly.
I'm teaching my kids how to do all of that too, just as well. Yes. Otherwise, I cannot do what I'm doing. And same for you.
Absolutely. You need your family support. Yes, epidural can slow down the process of birth. Yes.
Definitely, yes. Epidural.
There's a time and a place for epidural.
Right.
But I would really prefer that you're not on it unless you seriously are having a complication that warrants some kind of an intervention, like a cesarean or whatever.
Right. So now, last question from the list I have before we have a little bit of time left for some questions here, if there is time. So where do you draw your strength from in low moments of life? You are a strong woman. So mashallah, what?
Well, first of all, may Allah make me as good as you think. He is the judge of all things. But I will say that faith, there's nothing better than our Islamic faith. Understanding that Allah won't put on us anything more than we can bear, and doing this work for the sake of Allah is very fulfilling. So I would say, first of all, our faith is. What other answer would you have for that? Well, and beyond that, I would say my husband is my biggest cheerleader, my biggest support. He just walked in the room and put his thumbs up, right? Alhamdulillah. So I would just say, at the end of the day, though, really focusing on your faith and your deen, and trusting that Allah has planned everything that's going to happen. So yes, you can check your own vagina. Usually you're not checking for dilation and effacement, Zainab. You're checking basically to see how far can you enter your fingers, and usually it's not you doing it, it's your husband doing it for you. Which is not weird, because he did something to get you pregnant inside the vagina. So obviously he knows his way around there. So I always say, if you're not sure, like, should I go to the hospital? Is it time? Like, let him do a vaginal exam, as long as your waters aren't broke. If he can stick his fingers way up into your vagina, you probably have plenty of time. If he sticks his fingers in and you run into the head, then maybe you ought to like get yourself going, because you're going to end up with an unintended home birth. But yeah, you can absolutely check your own vagina. Why not? It's your body.
Right. All right. Let me see if there's any questions that we could consider that we haven't. If anyone has any questions now, we've got like 3-4 minutes before Aisha has to start driving down to Saudi. So I really want to make sure.
I'm driving to Saudi tonight so I can fly to Oman tomorrow, and then the next day to Jakarta. And then after that, I'm hoping to go to India. If any of you here are in India, I would like to see you in India.
Yes, I'm gonna share the slides about that next before I talk about that. So we talked about the high AFI, and okay, I think we have. Oh right, wait. Anyway, just send your questions again if you want here. So when she's coming to, so let me just change the slide so I can share all about the next upcoming stuff. So first, I want to thank you all for being here, and thank you, Aisha. Let me give you a virtual hug from all the mamas that said to give you one.
It is my pleasure and honor, Hafsa, to be here with you. Alhamdulillah.
Jazakallah.
And I wish I could drag you to Pakistan with me.
I wish. All right. So I just want to talk about the Blessed Start classes, the ones that I was referring to during this talk today. So it truly prepares you for birth, labor, postpartum, support that you need. And I always say my support never ends with the classes. It's got all this covered. So I have an ongoing group, mashallah. It's really keeping me busy. It's a big group. So the next one starting after April, and the registrations have already started and opened. And I'm supporting those moms already, alhamdulillah. So the next one starting in April, right after Eid. So if you want to grab it, I'm teaching it in Urdu, in English, and in Arabic.
MashaAllah.
So if you have let me talk all 3 languages. So agar aapko Urdu mein classes chahiye, please contact me. This is my contact details, which I shared here. إذا تحتاجون الكلاسات بالعربي حياكم الله. And of course, if you need classes in English, you can contact me. All right. And then I want to talk about the professional training. So Aisha is coming first to India at the end of February.
Mm-hmm. That's actually right after Jakarta. So I'm going to Indonesia first and then to India. India, I really, really want to reach out to anybody who's in India who might be interested in becoming a childbirth educator and doula like Hafsa, who's trained with me. We're doing that training in India. Our intention is to do it in India, but I need to get enough people who have committed for me to be able to actually buy the tickets and justify going. So we are looking for more moms. It's coming up quick. If you are at all interested, go to amanibirth.com, find the teacher doula training page, register. There's no fee to register. Once you register, then you're on our wait list, and then I would be able to send you the information. I live in the U.S., Bilquis. I live in Delaware. I am willing to go anywhere in the world for the most part, as long as we have at least 10 moms ready to take, 10 women, I should say, ready to take the class. So wherever you are in the U.S., if you're, in a community where you think that there will be women interested in doing a workshop, I'm happy to come. Yes. I'll be back in the U.S. in May, inshallah.
And Abir, if you want India to happen, please help me spread the word. She's one of the mamas.
Oh, mashallah.
All right. So you can see the website on the screen. This is the website you go in, or you can WhatsApp here.
Yep, that's my WhatsApp number.
Yeah, but I should let's do the website first, so that's not overwhelming WhatsApp.
Well, if you WhatsApp me and say I'm interested in the India training, I'm going to say go to the website and register.
Yeah. So anyhow.
So
and then the next one, which I'm super excited about because I work a lot with my Pakistan mamas. Mashallah, mashallah. I was just sharing Aisha the number. How much did I say when we were at the hospital? So the Pakistan mamas, it was 300 mamas. It was 300 mamas.
Yeah, mashallah.
All about it. So Pakistan, it's happening for the first time. So just like India is happening for the first time, Pakistan is happening for the first time. And we have a lot registered, but we want to make all 3 cities happen. Yeah. So it's happening in April, right after Eid. Plenty of time for you guys to plan it. Please do it. It's life-changing. Again, amanibirth.com. You can go there and sign up, inshallah. All right, so really, really excited about that. And my next event, which is coming up, is a Ramadan while breastfeeding. Yes, so that's happening on the 12th, on the 12th of Feb, which is in 10 days. So alhamdulillah, that workshop's really getting full fast. It's got lots of bonuses and support because I don't teach birth classes in Ramadan. I do this. I take a little bit of time off, and then I just continue giving the WhatsApp support and everything in breastfeeding, inshallah. So these are the next upcoming events. Let me just go back quickly to the thank you page. All right, so that anyone wants to note down the phone number and the contact details. This session is recorded. I will upload it onto my YouTube, and my account, my YouTube page and everything is on my Instagram, or you can just scan this and join there. Don't forget to follow AMANI_birth as well. There you go. to stay tuned about everything that's happening there.
Yeah,
inshallah.
absolutely. And Fariha, I would love to schedule an Eid party. So I did not buy my tickets yet to Pakistan. So we got to figure out what day I should arrive
Right.
so we can have that party.
Inshallah.
And have all the sisters come so I can meet everyone, inshallah.
And Bushra, one of my special mamas, that she says that you both are my inspiration.
Oh, mashallah, mashallah, alhamdulillah.
Alhamdulillah.
Well, I have to say all of you are my inspiration because the heartwarming responses that I get, from people all around the world that say that they took a class with someone like Hafsa, or they read my book, or they saw a video that I did or whatever, and that it's changed their birth or changed their life. It's each one of those fuels my passion to keep doing this work. So I just really think, like Hafsa said, like the AMANI birth book should be on the bedside table of every woman of childbearing age. And I don't say that because I wrote the book. I say that because it's a life-changing read, and it is a life-changing experience. Birth is a transformative, not only for the child but for the mother, and we shouldn't take that lightly. We should really get educated and make sure. I always say, like, we're the Umrah of Ikra, right? We're the community of read, right? Right. And so please read and learn what you didn't know and get yourself prepared. Open your eyes. Birth is the whole childbearing year journey. To me, is just precious. If I could be pregnant again, I would. I'm just too old now.
Well, for me,
I'm waiting for the grandbabies now. I don't have
exactly.
I don't have any.
In my case, I'm just like, I wish it just it doesn't end at birth.
Yeah, mashallah, mashallah.
Alhamdulillah. There are a few other questions about postpartum weight loss and fetal distress. So how about, inshallah, let me address that in our upcoming things. I just really want to wrap up and not take more of Aisha's time. I just thank you. I want to thank each one of you for being here. And I really hope this was beneficial for all. May Allah make it beneficial for each one of us, inshallah. And jazakumullahu khairan, ya'tikum al-afiyah. And an Eid party in Lahore, inshallah. Yes. Get your party wear. So
yes.
Do you have party wear?
Yes, I'm ready. I'm going to bring my party shoes.
Right.
Actually, I'm going to take my shoes off because we're going to probably be praying.
Yes. Alhamdulillah. All right. Wa yakum Rumaysa. Thank you so much. And yes, definitely, Javedi, I look forward to having you in the Ramadan breastfeeding workshop. If you're due in May, it's never too late. So, you already did a birth prep course. Excellent. Well done. How old is too old?
How old is it? Well, I'm old enough to be a grandmother. I've got children who are married. You think that's too old? Yeah, I have 4 children that are married, guys.
Right.
Half of my kids are married, and 5 of them are adults. So.
Right.
And I have a daughter and a son, both that want to get married. So,
yeah. Alhamdulillah. Jazakumullahu khairan. Thank you, everybody, for being here. I just love this. This has to be my favorite episode. I can't wait for
mashallah, thank you. Alhamdulillah. And I did an episode with Fariha. I think I did her first. It was funny because I did the first when she was interviewing inspiring women, and she chose me to go first. What an honor! And then she had me back again. I don't know how long later.
When we were launching
when we were launching Pakistan. So you both of you ladies, like, you've come through my training. You're my people. Like, you're my babies. Like, these are my babies.
I love you, Aisha.
And I'm so very proud of you. And the work that you're doing in your community. So super, super, super excited. Hafsa brought me to Kuwait. Fariha is bringing me to Pakistan, and Hafsa is helping with that. At the end of the day, like, I wouldn't even know anyone in these communities if it wasn't for these ladies stepping up, investing in themselves, and then giving themselves back to the community. SubhanAllah.
No, I'm so glad. I was just telling Aisha, the last 2 weeks were crazy trying to get the training into Kuwait. But alhamdulillah, it happened.
Yep.
Alhamdulillah, we're sitting here.
Alhamdulillah,
we got
this. Done.
Yes, now you need a nice massage. Yeah,
exactly. Ashley, I need to get to work now.
Oh yes, you got it. Oh yeah, the academy. She's doing so much.
The AMANI Academy is amazing. Yeah, that you're part of. Much to love.
Yes,
Wilkies. Yeah, absolutely.
You've got 2 brothers to get married. Should I shout out to either?
Yeah, exactly. Alhamdulillah. But you know how to reach me. Alhamdulillah.
Yes, you got all her contact details. Jazakumullah khair, ladies. I hope to see you all in my upcoming workshops and sessions. I've got other episodes up there already. Fun births. There is even those that lost babies. So I did an infant lost session as well. There is like home births that I shared. Lots of things you can find, and I really hope that I will do the next enriching talk is going to be before Ramadan for pregnant moms who are like about fasting and all that. That's coming up with a nutritionist, inshallah. So stay tuned, And thank you very much. I think we can just talk all day, but we really need
Yes.
to wrap it up.
And I love to see those of you who are in Pakistan soon. I love to see those of you who are in India soon, and wherever else you are in the world. Just get yourself a group of women that want to bring me, and we'll come. Inshallah.
Jazakumullah khair. Let's recite the dua before we end it for today. Jazakumullah khairan. Subhanallah wa bihamdihi. Subhanakallahumma wa bihamdika. Nashhadu an la ilaha illa anta nastaghfiruka wa natubu ilayk. Jazakumullah khairan. Thank you. Special thank you.
Love
Aisha.
you so much, Hafsa.
Love you too, Aisha. Assalamu alaikum wa rahmatullahi wa barakatuh.
Assalamu alaikum. Alhamdulillah.